Moving to the next session on mental health awareness by Dr. Gupta, Gaurav Gupta, I request Dr. Lavleen Gupta to extend the floral welcome to our respected speaker, Dr. Gaurav Gupta. Mental health is an important aspect of a student's life. In these 4 years of journey, you will have nice happy moments when you perform well at college, but at times you may feel some peer pressure, examination pressure. We have here Dr. Gaurav as our next speaker, who is a consultant psychiatrist at Mind Circle Neuropsychiatry and Drug Addiction Clinic Rohini. He is MD in psychiatry from PGIMER Chandigarh College. He will deliver a talk about mental health awareness. Dr. Gaurav, over to you. Thank you.
Thank you very much. Good afternoon, everyone. And first of all, congratulations to all the newly admitted students. So, today I am going to talk about mental health awareness. Awareness simply means whether we are aware what's happening with us. For example, whenever we are ill from any physical condition, we know it. If we are having fever, we know that some infection might be there in our body. If we are feeling pain, we know that there may be some injury. Similarly, we experience headache, high blood pressure. So we are aware of physical conditions. Whatever happens to our body, we are aware. So I want you to understand that's it equally important to be aware of mental health conditions. What's happening to our mind? How is our mood? What emotions we are experiencing? What thoughts are coming up in your mind? So that means mental health awareness. I'll start by discussing first the definition of mental health. So let's define mental health. Mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with normal stress of life, can work productively and fruitfully, and is able to contribute to his or her own community. So being mentally healthy means we should be able to work at our optimum capacity. Vis-a-vis mental ill health means mental illness or health conditions which involve change in our emotion, thinking pattern, and behavior. Mental illness, just like physical illness, are associated with distress and they affect our functioning. Functioning at workplace, functioning in academics, functioning in our relationship. So when we are not healthy, then functioning got affected. Okay, so coming to next slide, mental health is a continuum. Means our mental health keep on changing, just like physical health. Sometimes we are working at our optimum level. At times we fall sick, and then we again, after some treatment, come back to normal. So similarly, mental health is a continuum. It's not that we are mentally ill or mentally healthy. It keeps on changing. So mentally totally healthy means we are in calm and steady state. We are fit, rested. We are able to control our emotion well. We have sense of humor. We can recognize whenever one is passing some comments in humor. We are relaxed, spending our time in recreational activities and confident. So this means that we are at this time are mentally healthy. At times, our mental health may take a dip and we may be reacting. For example, whenever there is stressful situation, just before any exam, just before presentation, may we feel easily agitated, angered, feel anxiety, nervous, impatient. So that stage is called reacting. When stress increases and we are not able to cope up with it, then our state can be injured. It means whenever we are feeling anxiety and sadness that is persistent. Persistent means most time of the day and most days of the week. We are easily getting angry, we are finding difficult to concentrate, we are having sleep disturbance. Sometimes we experience physical symptoms in form of headache, body pain, lethargic, weakness, and our functioning is affected. In some condition, unfortunately, we may fall ill when stress is very much overwhelming. Stress may arise because of variety of circumstances. If we feel excessive anxiety, fatigue, sadness, if we are having anxiety attacks, also called panic attacks regularly, if for a consistent period of 2 weeks or more than that we are not able to concentrate, if we are avoiding our family members or friends, there is change in our behavior, any thoughts of hopelessness, worthlessness, which are persisting for a long duration of time, then it means we are not well and we are suffering from any mental illness. After treatment, we may again come back to a normal condition. So just like physical health, mental health is a continuum. We may be ill or we may be healthy, but it keeps on changing. So next slide, why we are talking about it? Because often mental health is ignored. We are not aware of our mental health. But if speaking of data, 1 in 4 people will experience mental health problem at any point of time in their life. 1 in 6 six workers are experiencing depression, anxiety or stress. Over a period of time and especially after COVID, the incidence of depression, anxiety or mental health conditions are increasing day by day. And we must be knowing someone in our family, friends or nearby may be suffering from any mental health condition. So that's why it's very important to talk about mental health. Now coming to stress, what is stress? Stress simply means the degree to which one feel overwhelmed or unable to cope as a result of pressure that are unmanageable. So we daily experience is stress. For example, traveling to college, traveling to our workplace is a stress. If our car is not working fine, if we have to take public transport, that is also stress. That is a daily stress. But at times, stress may be unmanageable. Stress necessarily doesn't mean that it's bad. Sometimes stress helps us to work better. Whenever we feel stress, we work at our optimum capacity. But in some conditions, stress can become unmanageable and can cause various physical symptoms or mental health symptoms. Stress can arise due to variety of condition. It can be related to our work, or in your case, it may be related to academics. Then money matters. Many times we experience stress because of financial issues. Relationship issue is another cause of stress. Although our family members, friends, and partner are helpful, when we talk to them, we feel better, we enjoy with them. But at times, relationship can cause stress also. Events such as ongoing minor arguments, disagreement, family crisis such as affair, if someone is ill, or after loss of loved one, stress can become unmanageable. Now, stress is not a psychiatric diagnosis. We all experience stress, but it's closely related to our mental health. Stress can cause variety of mental health problems and can make various problems which are already there worse. Various mental health problems can also cause stress. Sometimes stress affects us physically. Let's discuss how stress affects us. This picture is showing a pool on which there is a lot of burden, and after a time, after a prolonged period of stress, it may break. Stress can present in various ways. There can be cognitive symptoms. Cognitive symptoms include memory problems, poor judgment, inability to concentrate. We can also label as brain fog, difficulty in making decision, self-doubt. These are cognitive symptoms of stress. Then there can be emotional symptom of stress like sadness, moodiness, irritability, anxiety, frustration. These are emotional symptoms of stress. At times, stress can present with physical symptoms. We can experience chest pain, increase in heartbeat, palpitation, dyspepsia, frequent colds, increased frequency of urination, high BP, because both body and mind are associated, they are related. So whenever our mind will be stressed, there can be some bodily symptoms also. Then there can be changes in our behavior due to stress. At times, we try to manage stress by indulging in increased intake of various drugs, alcohols, or tobacco. At times, we can isolate ourselves from our friends. We avoid discussion, sleeping too little or too much, feeling demotivated. These are behavioral symptoms of stress. So it's important that we recognize whenever we are facing stress and take appropriate steps to handle it. So what are those steps? By simple lifestyle management techniques, we can handle this stress. First is having a regular activity schedule. So if we are occupied in some activities, excessive thoughts will not disturb us and it will help us in dealing with stress. Distract and redirect. Engage in activities which help us. It may be meditation, yoga, reading, doing art projects, breathing exercise, listening to music. Physical activities are must. Physical activity in any form, be it brisk walk, jogging, running, any form of exercise, even exercise can be done at home. Now in winter season as pollution is increasing, we can do light exercise in our home in any form. Limiting media consumption, sometimes negative news affect lot of us, so avoid continuous exposure to news, media and social media. Minimize use of alcohol, tobacco, caffeine, weed or any other substance. They may help in short term. For 1 to 2 hours we may feel relaxed, but as the effect will wane off, stress will increase. Next is recognizing our emotion and thoughts. It's very important that we should be able to recognize how we are feeling. Are we feeling sad? Are we feeling happy, anxious, or agitated? And what are thoughts, various thoughts coming up in your mind? If you can identify thoughts, you can change them and your mood will change according to it. Next is boosting your immunity. We shouldn't fall sick, so having a healthy diet is very important. Even after this, if symptoms are there, they are severe, they are persistent, then you should not hesitate to meet a psychiatrist or nearby psychologist. And effective treatment is available in form of counseling, psychotherapy, or in form of medicines. Thank you.
Thank you, Dr. Gaurav. I request Professor Rajeshwari Pandey ma'am to felicitate Dr. Gaurav with a shawl as a token of our gratitude.